Good morning, welcome to today. So you can see we're multiplying, there's now 4 of us. So today we're joined by Celia Champion from Painless Practice, who I'm sure many of you will be aware of. Celia is originally from South Africa and used to have a large family business in South Africa, and when she moved to the UK, she started working with Painless Practice, which helps clinicians and clinic owners learn how to run their business more effectively. We're also joined by Justin and Dave. Justin and Dave are podiatrists and now healthcare business mentors too. And today we're talking about what our business assets truly are. So welcome everybody. Good morning.
Hi.
Hello.
How are you?
Very well, thank you very much. The sun is still shining even though it's been a little bit windier and a little bit chillier. Right, so Celia, let's begin with you. What do you see in clinics are the true business assets, especially at this time when everybody's been stripped to really...
Well, I mean, my kind of go-to starting point is, if I take the clinic owner out of the business, do we still have a business? So that's the first thing that I do. And then when you take the clinic owner out of the business, what holds that business together is the people. So I kind of think that one of the really key assets of a business, obviously we're talking about physios, and if physios are, treating patients, you need a really good team around you for you to have a really good business. And then we've got to look at the models and the structures of how those teams are put together for it to be a really great team and a strong team that keeps your business together. That's my initial thoughts.
Super, thank you. Justin?
Well, I mean, I think when you look up when you Google things, assets of business, you get the very dry accountancy. Your computer equipment, the treatment equipment that you use for your patients. But of course, those aren't really any sort of tangible assets. And as Celia was saying, it's really the people and the systems that you have in place already in your practice that are the real assets. And I think we've talked about before about how, especially at the start of the close down, how really important to start to touch the people and to sort of to continue to nurture them. And I hope that a lot of practices have put that into practice, and that they have actually touched base with their sort of patients, because the assets that they have when we're going to be coming out the other side of this are really going to be down to how they've looked after their patient base through this.
So you're both describing there very much how relational the assets are, because the accountant, yes, we have our balance sheet from the accountant with our assets on and our liabilities on, but what's interesting is straight away you've brought up things that are not what an accountant would put on a balance sheet, and it's very, very relational with the team and with our clients. Dave?
Yeah, both of those absolutely spot on. The conversations I've been having a lot with people recently have been around brand building. And I was actually having a conversation with one of my clients yesterday morning about this, and we were mapping out his assets. And he doesn't have a team. He works for somebody else. He has patients via that other business. He doesn't have any kind of clinical setup. But what he does have is he has him. He's a massive asset, and the way he shows up and the things he does and the things he talks about. And we actually mapped his assets out in terms of all of his marketing kind of pillars. So, his different social media profiles, they're massive assets. Anything which you can go online and find and download. His email list was a massive asset. So I think a lot now about assets, about the thing, especially where we've had patients who are not in clinics. We've had people being furloughed and clinics aren't running in the same way. What are those assets which keep you top of mind and tip of tongue for all the people out there? What are the things which are going to help your marketing when COVID goes away, when we start to come back out of the wilderness, or with big beards and looking a bit shocked by the daylight? What are going to be the things which are going to keep our marketing really on point to bring those patients back to us and to bring loads more patients to us? So I think about assets in that respect.
Thank you. So something that I have done and found really helpful, when I recognised that the business balance sheet really didn't show what I felt my business assets and liabilities were, I found that doing a SWOT really, really helpful. And I've used this lots of times, and it's the first thing that I did with the team when I realised we were going to close, and started to see that the strengths and the opportunities were almost exactly the same as the non-financial assets, and the threats and the weaknesses were the risks and the liabilities, again, as if it were a non-financial spreadsheet. And I found that a really useful tool to use to separate assets and liabilities. And something that I know we've touched on in the last couple of weeks is about community, and Dave has shared with us particularly his thoughts about how global the community could become and what the opportunities are for clinicians to reach a much more global audience. But equally, is one of our assets going to be our very, very local community, because people are certainly getting much more conscious of their local community and buying fruit and veg and locally, and small businesses that perhaps still are open locally are perhaps doing quite well, such as the Fruit and Veg Man, because people are conscious of supporting them. So how much is our local community actually one of our assets too, that we perhaps don't always pay enough attention to, because we think about our team and we think about our database. Do we make sure we extend that little bit further into the town?
Yeah, I was talking to a practitioner a couple of weeks ago who she's a domiciliary practitioner, so she goes out to people's homes. She can't do that at the moment. What she's doing instead is she's volunteering. So she's going out to pick up people's medications, and she's going out to pick up shopping for people, and having those conversations with people around that. And what she's found is that people will, invariably during that conversation through an open window or with that safe distance, people go, what do you do? When you're not doing this, what do you do? And she talks about the fact that she's a domiciliary practitioner, looks after people's feet. She's already picked up clients from that because she's helping out in the community, and they're seeing the value in what she's doing, and they want to reciprocate and pay her back for that. So the community stuff is massive. And I was telling the story before we started recording about me ordering some weights on Sunday afternoon at 3 o'clock and having them hand delivered at 2 o'clock on Monday. The feelings I have for that business is they're an amazing business, and I've now become an asset to that business, because I will, when people say, where do I get weights from? I go and see those guys without any question at all. So you're absolutely right about that community thing, about having people in the local area who support you and turn up and help you out at times like this, because they create some amazing raving fans, which is brilliant.
Yeah, for long term. Being part of the community is one of the would be one of the pillars of going forward and progressing your practice.
I had a client. Well, I have a client, but years ago he had 4 practices, and one of them was just really not doing very well. And one day he kind of said to me, "Oh, he's so fed up with all these people asking him about what's going on down the road in the thing." And he says, "I'm just so fed up with all this, and I just keep telling them now that I don't live here, how must I know?" And that was the nail on the head. And I said, that's why this practice is not succeeding, because you don't care about their local community, because all the patients that you have, they use the pubs, their kids go to school there, so it is definitely, you've, showing interest and supporting the local community can only be a good thing and a good asset in your business.
So that's really interesting, because when I had my clinic in Worcestershire, in Kidderminster, there was a local celebrity. His name was Mr. T. He used to own a shop in a part of town, and he was kind of a local hero. And when he died, they actually had, and they now have an annual park event. They obviously won't have it this year, but they have an annual park event on. And one of the people who kind of volunteers to look after that area, have like a local area with a group of people, and the mayor comes in, all that kind of stuff. And they contacted me and said, will you come down, and will you sponsor a stand and come down and have a stand there? It's like, yeah, absolutely. Because I want to be seen by that community. And while I probably didn't pick up any clients from that directly, the fact that I was involved in it and the fact that I got to talk to people had a massive impact. So yeah, that being involved in a local community is a massive asset. Absolutely.
Yeah. Another, I had a conversation with a client yesterday, and you know, one of the other obviously very valuable assets in your business is your database. And so your database, you could have 10,000 patients on your database, but if you don't manage it correctly and you don't have a correct system in place, I mean, I've got literally, she's got no practice management software system. So I've given her a few to go and look at and decide which one she's going to go for, and she's using this time when she can't be treating patients to actually tidy up her database. I had another client last year in August who moved from one practice management software system to another. And when we started looking at the data, it was in a horrendous mess. There were things in the wrong fields. The numbers were incorrect. It was just a real mess. And they had 8,000 people on the database. And I mean, our time in August, we usually quieter. So I just got my whole admin team. I had 4 of my administrators working to just tidy up their database so that when they uploaded it to the new system, it was squeaky clean and you could get decent reports and you could really use your database. So I'd say, you know, in terms of current times now, if you've got time in your hands, that is a really good use of time.
Yeah, I know Justin's been talking about this a lot, haven't you, about email marketing? I mean, and but I think did you ask the question? I might be wrong. Did you ask the question? You know, how many people have got an email database? And the number of people in podiatry who kind of go, no, I haven't got one, is quite interesting.
Who don't even have a phone database or it's on or it's written down on. So I mean, I think what people could be doing now, and I think this is really important to do, and there seems to be a big push for now, it's how am I going to get my PPE and how am I going to get all these other things in place for when we open back up again. But maybe I would like to think that it's given a lot of practices time to think, do I actually want to run it like this now? Is this not a golden opportunity now to say, what is the sort of practice that I want to have in 5 years' time, 10 years' time, and work backwards from there? Because I think going out and just opening up and just doing the same things that you were doing before in the practice is going to end you up in the situation that you were currently in again if something else goes wrong. And so I think, this is the opportunity, the practice of your practice of your future to look like.
That's right. It's really interesting. Actually, I had a message yesterday from someone who's a friend who's got a clinic, and she said, I've kind of run the numbers. I've gone through my balance sheet. I've looked at what it costs for me to stay open, and I've realised that actually I can stay open, you're spending less money. So I'm not going to be working to the same degree that I was working before this. After this, I'm going to change everything, and that's really quite refreshing to hear that people are making those decisions. It's a good thing.
Are clinicians and clinic owners recognising that it could be a very large disruptor coming to our industry, in that supermarket healthcare could be something that emerges on the back of this?
Boots tried that a few years ago with podiatry and physio, and didn't work. Very expensive. I heard that years ago about Tesco's and Sainsbury's were going to have everything under one roof like they do, but also medical services and things. And those sort of concierge type of, Medidoc in London Victoria Station, I don't think those practices have really taken off or sort of scaled
because
anywhere. I think at this time, especially manual therapies, and I think we're really in for a boom time after we come out of this, because the whole thing now is for people to get healthier and fitter, and there's going to be a higher profile of sort of health and fitness. So I think the practice of the future is going to really benefit from that, because that's all you hear about is get fitter, get healthier, and people are exercising at home now already. And so I think this is going to be a real. People are going to be more aware of their health more than ever.
People are eating. But people are either going to invest in these things, or either going to say, right, I need to invest. You know, I've missed someone looking after my feet, or I've missed somebody, you know, helping me out. I'm going to go and invest more in that. Or other people are going to go, no, actually, I can realise now I can manage without it. I've managed it at home, so I don't need that. But Kate, just going back to what you said about the supermarket stuff, I think, you know, there's a lot of people, and you've talked about your business setup with, you know, PAYE, you know, how that's benefited you at the moment. A lot of limited companies are smaller amounts of PAYE, larger amount of dividends, and that hasn't served them. I mean, you couldn't foresee that hasn't served them in this crisis. I think there's going to be a period where people get a little bit worried about going down that bigger company route and will stay in smaller entities. Mm-hmm. And it will be 2-3 years down the line. I think there'll be somebody will be brave and go, right, you know what? Now's the time to invest in this. They will build a bigger business, which may be that kind of supermarket thing. And they will corner the market for a good while, and they'll make a good income from that. Mm-hmm. But I think there's going to be a little bit of nervousness initially about going down that route. So, but we'll see. I could be wrong.
I mean, I think practices are going to, on the back of the health benefits that people are now and more health awareness, practices are going to be better placed because. The cleanliness of the practices and the government sort of directed sort of standards through the HPCP in the UK and things, that's actually going to be a benefit to the practices because that's what people are going to be looking for. So social distancing is still going to be in place. All the guidelines that you have to follow for cleanliness and decontamination. Clinics and instruments and things, that's what people are going to really be looking for. So that's what that will attract people into the practices. And I mean, there is going to be that sort of change, as we talked before, about not having to drive around half the country for consultations.
Yeah.
But I think that if we go back to selling the commodity of a half-hour session with a chiropractor, the routine foot treatment, the rehabilitation class. If we just open up the practice again, and that's what we're providing, which is a commodity, I think then that's not going to be the way to sort of grow and develop the practice from this. It's what's happening with telehealth, because now everybody's selling telehealth, but they're selling the commodity of telehealth rather than it's actually what the patient wants. And it's starting to have that conversation about what somebody actually wants when they come to see you.
So if those that we serve, our clients, ultimately in community, ultimately tell us or confirm to us what is and isn't our assets because it's what they're wanting to purchase. Celia, what's your view on what a clinic's asset truly is based on what it is that the clients are actually buying when they're purchasing healthcare? And how does that make you feel confident or nervous for the small clinic about the competition from a larger chain?
I mean, I think at the heart of it, quality is probably right at the heart of it. You know, I've been obviously involved with Physio First, and they've got their Data for Impact program that, and you know, then clinics are going for their quality assured clinics. So they're going for the QAC, and practitioners are going for QOP. So I really do think that is what people are. That's what people are wanting, is equality. Now, how that quality is delivered, I think that there's probably in the future some clinics are maybe going to be carrying on with the online consultations in some cases, and you know, when it's safe to open again, and you know, the kind of social distancing things have started to relax a little bit, then they will be opening and doing hands-on treatment again. But I think that there may very, very, very well be a combination, but I think that it is going to be based on quality. That's what patients in the private healthcare are looking for. And so that could be another thing, if you are if you're a physio, is to look at getting involved in the Data for Impact and going for a quality assured clinic status.
Okay, Justin, what's your view on what it is that our clients are actually purchasing?
The outcome, the it's like when you buy a holiday. You're buying lying beside the pool with the pina colada in your hand. You're not buying the plane trip, the bus and coach journey to get you there. So that's what people are. They're buying the outcome from you.
Yeah.
They don't care how you get there. They don't care whether you got They don't care what machine in your corner of your clinic that goes bing or makes fancy pictures. And that's back to the commodity. If you're selling ultrasound, guided injections, orthotics, rehab therapy, you're selling a commodity. They don't care about that. They want the outcome that they want to get from you. That's what really you need. That's what we need to really. And especially now, again, if you start talking to people about that now, loads of practices are still booking appointments for the future and still organizing classes and still doing a lot of things with their patients and with new patients that they're getting, so that when they can get back and get hands-on, that they're going to hit the ground running. But the message has to be not what you can do to them, it's what's their problem, why is it to get it fixed, and how you're going to go on that journey together, rather than what you're actually going to technically do to them. That's the difference. That's how you need to change to speak to people.
So it becomes more and more important that we communicate that we are listening to you and understand you and working in partnership with you. And
it's about the patient. It's what the patient wants to get back to doing. So if they want to get back to being able to run 5 kilometers or be able to pick up their grandchildren, or when social distancing is okay.
Yep.
It is the outcome, as Justin says. It's like what the patients are buying. You've got to figure out what their why is. Like, why are they coming to you? Because they want to be able to sleep better at night. Because they want to be able to,
But why are they coming to you rather than somebody around the corner who has the same commodity for sale?
And that's where I think quality comes in.
Yeah, but quality, but definitely the quality combined with the message.
Correct. Yeah.
Is the message? They're just the words in a different way. Again, some of the website changes that people have made, just putting words in a slightly different way, makes all the difference to the conversation that you have with people.
Dave, do you wonder if the current situation with the COVID virus is going to change what it is people are actually buying? So perhaps instead of it being that I want to be able to run a half marathon, it's I'm now so aware of my health, I want to keep healthy so that I am not vulnerable, and that we've been stripped to more basic reasons why we're keeping healthy.
I think it will change things. Yeah, I think it will change things. I think, touching on what Celia and Justin were talking about around quality and around, showing that you can solve people's problems. I think that the biggest thing for me would be understanding. I want if I go to see a practitioner, I want them to understand my problem and understand what I want to do. So, for example, as a guy, Mike James, who's out in Wales, who's the endurance physio, his physiotherapy very much sits around going out and doing distance races and ultramarathons, and because of that, he's an ultramarathon runner. So I'm going to seek somebody out who not only understands my problem, but maybe has had that problem before as well, and also has the quality indicators to show that not only does he understand the problem and he solves the problem, but he does it repeatedly and he can do it again and again and again. So understanding quality and trust, but it will change. It will change people's focus. People taking up sports now, which they haven't even thought about doing before. People taking up running because it's a quick way of getting exercise. People, changing their whole exercise and activity regime completely. But yeah, it's going to change the landscape of what people want, of what people actually want to go out there and purchase.
Which perhaps brings us right back round to where we started, about how important the relationships are with our team, with our database and with our community. And if we can get our business organised so that our time is spent committed to the relationships and really listening to what our clients need, we can make sure our asset is in line with what our community is after, what our database are asking of us, our team are asking us, and we're asking of it.
Yeah, complete shift. And I, you know, touched on and said, Justin, machines don't go bing in the corner, they go ping in the corner. This is, you should, yeah, you're not listening to them properly. But this, you know, people in their marketing and advertising, they lead on the qualifications they have, and they lead on the equipment they've got, and they lead on what they do. And, you know, that touching on the, you know, the whys is massively important. No one cares about my qualifications or my insurance or the machine going ping or bing in the corner. They care about an outcome. They care about, you know.
How important is it that as clinic owners, we commit to getting our business fundamentals right and in place now, so that we can invest in the relational aspect of our business on the other side very, very committedly and intensively, and therefore mitigate collectively the risk of large chain healthcare that perhaps doesn't necessarily provide the same personalised service that a local clinic can.
Yeah, I think it's interesting if a large chain organisation can provide very personal care in an affordable way, that's where the risk is going to be to the small clinician.
So what does the small clinician have to do to prevent?
They have to be visible. They have to be out there talking about how they can help people and doing it, you know, top of mind, tip of tongue, and doing it a lot. I think what's really interesting, a lot of the conversations I've had is people have gone, well, I've got 3 weeks to catch up on my clinical CPD. And my first thought is actually, you don't need to worry about your clinical CPD at the moment. Unless you've got something you have to get done, you're already doing the clinical stuff day in, day out. What are the other things which you could focus on? And it is business fundamentals, relationships, looking at your systems, looking at your assets, looking at all these other things which you wouldn't even consider doing, or finding somebody else who can help you with those. So it's for me, the big piece at the moment is about being visible, and being visible as certainly in podiatry as an industry. We need everyone to be visible because it raises the profile in the public eye, and then people will come along and use us.
This week is the week for the second or third follow-up phone call with those patients who you didn't have your email with, or you didn't have anything with. This is the time. I hope you spoke to them 2-3 weeks ago. Now we're just checking in again. And anything more that I can do for you. And
that's
how are you getting on? This is the next week. What are you doing all day? You know.
Yeah.
This is pray for us. What are you doing that for? Or you know, just let's keep in touch, because we want to come out of this hitting the ground running. You don't want to be sitting in an empty clinic when this gets opened back up again.
Yeah.
But again, focus on how do you want your clinic to be in the future? You want to go back to be the same, that you weren't making that much money and you weren't having that much time off and you didn't get to go to kids stuff and you were just running to standstill, or do you want to work in a new way? That should be the conversation that you're having with yourself and with others now. How can I change it? I don't want to go back and do it the same way. Maybe you do. Maybe it was really working really well, but you know, a lot of clinics weren't like that. So,
Celia.
Yeah, I mean, most clinicians have got the opportunity now to really review. You know, it's kind of really thinking about what do you truly want. What is the situation right now? What's the current reality? And what's the gap between the current reality and what you really want? And therefore, you know, what do you need to be putting your focus in and your energy so that you can really kind of come out the other side stronger? Just on I think Justin mentioned kind of, you know, looking at your website and looking at the wording on your website. There's a really great book called Building a Story Brand by Don Miller. And he talks about how your message, you know, your marketing message is like creating a movie. And he talks about, you know, first of all, you have a character. And so that character is your patient. Just like, I don't know, Dave that said, you know, most things lead on all my qualifications and I've done this and we're so big and da, 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 da. Well, actually, you need to lead with your character, who's your patient. So identify your patient. And then he says, you have a character who has a problem, so you recognize what their problems are, who meets a guide, who is you, who gives them a plan, calls them to action, which avoids failure and results in success. And if you just kind of look at your marketing message and see, do you tackle, do you actually cover those things? And that's what people are looking for. People are looking to know that you know who they are, what their problem is, and what they want, what their success story is.
You need to know their fears, hopes, and dreams.
Yeah.
Donald Miller's book is stunning as well.
You need the avatar for the person, and then whether you're the ultra marathon rehab or physio guy, he has an avatar of what his endurance athlete is, and a lot of practices. So that's how you can talk directly to those people.
I think one of the mistakes as well that people make, and that the story brand, when I read it, it changed a lot for me, because there's a lot of people who believe that as the clinician, they are the hero in the story. Yes. They kind of sweep in with their big cape behind them, their underpants outside their trousers, and go, "I am here to save you." And it's not. It's that guide piece. And I think Donald Miller talks about. I'm being a bit of a science fiction fan. Donald Miller talks about the kind of the Star Wars thing as well. That Luke Skywalker is the hero, but it's Yoda who's the guide, and it's that different kind of setup. And when people go, actually, I'm not the hero in this story as a clinician. I'm actually the guide to help other people. Yeah. And if I treat my patient, my client, as the hero, it changes the dynamic massively. And that in itself is a really good asset, being able to communicate how you do that to people. Yeah, brilliant book. Donald Miller's book's brilliant. His assets are fantastic. I'm glad you mentioned that one.
Thank you. So everybody has just given you a clue as to what we're going to be talking about next week. Next week we are going to be talking about avatars and sales and marketing and communication, following having defined and understood and confirmed what you believe your business assets are. And that can be done by listening, obviously, to community, and also perhaps doing a SWOT analysis or something similar, so that you're looking at all the non-financial assets. So we'll be here again on Wednesday next week. And next week, everybody's just given you a clue as to exactly what it is we're going to be talking about. So we're going to be talking about communication, and we look forward to seeing you then. Take care, and we'll see you next Wednesday. Bye-bye for now.
Bye.
Bye.